an opening in the fascia transversalis. The deep inguinal ring, which is the inlet of the canal, it is an oval gap opening in the fascia transversalis, whereas the outlet of the canal, here, it is a triangular opening in the external oblique aponeurosis. So the canal actually extends between the external oblique aponeurosis and fascia transversalis. Okay, spermatic cord in male, round ligament of uterus enters through deep inguinal ring, traverses through the canal, and lives through the superficial inguinal ring. So we can understand that the canal lies within the anterior abdominal wall. It lies in the lower part of the anterior abdominal wall, above and parallel to the inguinal ligament, directed downwards, forwards and medially, extending from deep inguinal ring to superficial inguinal ring. Now here, this is the pubic bone, pubis. This is the pubis of the opposite side. Consider this as pubic symphysis. This is the anterior superior iliac spine. Okay. This is pubic tubercle. This is the upper margin of the body of the pubis. So that is the pubic crest. And this red thing is the inguinal ligament. This is the schematic representation. Now inguinal canal, it extends from the deep inguinal ring to superficial inguinal ring. Now what is deep inguinal ring? It is an oval gap in the fascia transversalis. It is an oval gap in the fascia transversalis 1.25 centimeter above the mid-inguinal point. Mid-inguinal point is the point between the pubic symphysis, midpoint between the pubic symphysis and anterior superior iliac spine. So this is the deep inguinal ring. What is it? It is an oval gap about 1.25 centimeter above the mid-inguinal point, and it is a gap in the fascia transversalis. Actually, if we look from the inside, from the peritoneal cavity, it appears as an oval gap, but from the margin of the deep inguinal ring, the spermatic cord receives its continuation, extension in the form of internal spermatic fascia. So this opening is actually arbitrary. There is no opening. From here, the spermatic cord enters the inguinal canal, and along with it, the fascia transversalis continues as the internal spermatic fascia. So that is the deep inguinal ring. Very one important relation of the deep inguinal ring is the inferior epigastric artery. So this is the inferior epigastric artery, very important, inferior epigastric artery, and deep inguinal ring is lateral to the inferior epigastric artery. It's a very important relation. The spermatic cord and round ligament of uterus, they wind round the lateral aspect of the inferior epigastric artery. Now superficial inguinal ring or the outlet. So what is it? It is a triangular opening in the external oblique aponeurosis. It is a triangular opening in the external oblique aponeurosis. It is triangular. The base is formed by pubic crest. It is bounded by two crura, inferior crus which is attached to pubic tubercle, superior or medial crus which is attached to pubic symphysis. Inferior crus attached here to pubic tubercle, and the superior crus or the medial crus which is attached here to the pubic symphysis, and the apex lies superolaterally. This is the apex where the two crura meet. It is directed upwards and laterally, and it is held together by intercrural fibers. And what is superficial inguinal ring? It is a triangular gap in the external oblique aponeurosis. This is deep inguinal ring. It is an oval gap in the fascia transversalis, whereas the superficial inguinal ring, the outlet of the inguinal canal, it is a triangular gap in the external oblique aponeurosis. Again, from the margin of the this superficial inguinal ring, external oblique aponeurosis continues along the spermatic cord as the external spermatic fascia. Okay, so that is the inlet and outlet of the canal. Now anterior wall of the canal, easy to understand that anterior wall, it is formed by, let's paint it yellow color. Okay, it is obvious that in its entire extent the anterior wall is formed by the external oblique aponeurosis, that you can understand, because this superficial inguinal ring is a gap in the external oblique aponeurosis. Superficial to the external oblique aponeurosis, there is superficial fascia and skin. So we can say the anterior wall is formed in its entire extent by skin, superficial fascia and external oblique aponeurosis. Okay, these three structures, they form anterior wall along the entire length of the inguinal canal. Now this is the inguinal ligament. As we know that the lateral 2/3, this part of the inguinal ligament gives origin to fibers of the internal oblique muscle. Lateral 1/3, this part gives origin to the fibers of the transversus abdominis muscle. Okay, so here you can see, as the lateral 2/3 of the inguinal ligament gives origin to internal oblique muscle, internal oblique, fleshy fibers of internal oblique or inguinal fibers of the internal oblique also forms anterior wall of the inguinal canal. So now the anterior wall is formed by skin, superficial fascia and external oblique aponeurosis in its entire extent, and in lateral half it is supplemented or it is formed by the inguinal fibers of internal oblique. Transverse abdominis does not form anterior wall as it arises from the lateral 1/3. Okay, so that is the anterior wall. Roof of the inguinal canal is very simple. The inguinal fibers of internal oblique, they first pass upwards and medially along with the fibers of the transverse abdominis, which also pass upwards and medially. Then these fibers arch backwards. They arch backwards. So these arch fibers, when they arch backwards, they form roof of the inguinal canal. So the roof is formed by the arch fibers of the internal oblique and transversus abdominis muscle. After arching this fiber, they pass downwards and medially, like this. They pass downwards and medially, and they are inserted to pubic crest as well as medial part of the pecten pubis. Okay, so fibers of the internal oblique as well as the fibers of the transverse abdominis, they arch backwards, and after that they turn downwards and medially, and they are inserted to the pubic crest and medial part of the pecten pubis as the conjoint tendon. So what is conjoint tendon? It is a common tendon for the fibers of the internal oblique and transverse abdominis. 2/3 is formed by the inguinal fibers of the transverse abdominis. 1/3 of the conjoint tendon is formed by the inguinal fibers of the internal oblique. These fibers, they arch backwards forming the roof, then they arch downwards and medially, and they are inserted to the pubic crest and medial part of the pecten pubis as the conjoint tendon. So it is interesting to note that the internal oblique forms anterior wall, it forms roof, and it also forms the posterior wall. We'll see it later. So far we have seen that inlet, outlet, anterior wall, roof. Now floor is also easy to understand. Let's paint it. The floor is formed by, it's very simple, it is formed by the grooved upper surface of the inguinal ligament. It's very simple, it is formed by the grooved upper surface of the inguinal ligament, medial part of the inguinal ligament, and medially there is a triangular expansion of the inguinal ligament, that is known as lacunar ligament. So the medially floor is supplemented by lacunar ligament. Okay, so floor is formed by upper grooved surface of inguinal ligament, and medially it is formed by the, or it is supplemented by the triangular lacunar ligament. Roof is formed by arch fibers of internal oblique and transverse abdominis. Anterior wall is formed by skin, superficial fascia, external oblique aponeurosis in its entire extent, and by fleshy fibers of the internal oblique in the lateral half. Now only the posterior wall remains. Let's describe the posterior wall. Okay, now posterior wall, what is the inlet? It is an opening in the fascia transversalis. So it is obvious that the posterior wall in its entire length is formed by fascia transversalis. This fascia transversalis blends with the posterior margin of the inguinal ligament. This attachment is very important because it closes the inguinal canal from below. The floor fuses with the posterior wall, which is formed by the fascia transversalis. So the posterior wall in its entire extent is formed by fascia transversalis. Behind the fascia transversalis, external peritoneal connective tissue and parietal peritoneum. Three structures form posterior wall along its entire length from deep inguinal ring to superficial inguinal ring, that is the fascia transversalis, deep to it extraperitoneal connective tissue and parietal peritoneum. Now posterior wall is supplemented by conjoint tendon, as I have described here. Let me just draw it here. Okay, let's use black color for this now. So this inguinal fibers of internal oblique and transverse abdominis, they arch backwards forming the roof, then they become tendinous, that is known as conjoint tendon, and by this conjoint tendon they are inserted to the pubic crest and medial part of the pecten pubis. So this conjoint tendon, it is easy to understand, it forms the medial half of the posterior wall of inguinal canal. Okay, now there is one more structure which forms medial 1/4 of the posterior wall, and that is one expansion of the inguinal ligament from the pubic tubercle, that is known as the reflected part of inguinal ligament. So there is an expansion of the inguinal ligament which extends upwards and medially from the pubic tubercle, superficial to or anterior to conjoint tendon, and it is inserted by interlacing with the fibers of the opposite side at the linea alba, that is a reflected part of inguinal ligament. So now collectively the posterior wall is formed by fascia transversalis, extraperitoneal connective tissue and parietal peritoneum in its entire extent, conjoint tendon in medial half, and reflected part of inguinal ligament in medial 1/4. So that completes the formation of inguinal canal. Deep inguinal ring, superficial inguinal ring, anterior wall, posterior wall, roof and floor. Content, we all know that contents of inguinal canal. The true content is spermatic cord in male and round ligament of uterus in female, and the partial content is the ilioinguinal nerve. Spermatic cord and round ligament enters through the deep inguinal ring, passes through the inguinal canal and leaves through the outlet, that is the superficial inguinal ring, whereas the ilioinguinal nerve, it runs between the internal oblique and transverse abdominis muscle. It enters the canal through the wall, it runs superficial to spermatic cord, and it also leaves through the superficial inguinal ring. So okay, if you have any doubt and question, you can ask in the comment section and we can discuss. Thank you.